So my name is Zahid Ali. So what I am presenting, I'm happy to present over on HMIS this great conference. So the topic of my presentation would be harmonizing a central telehealth initiative for the country, and it's basically uh, the future of healthcare, how we take the care from hospital to home. So, a brief about me. I'm basically a digital health innovation strategist working over here at with Ministry of Health as a consultant. I'm founder at Tech Meadow, which is a startup that is fixing future of care delivery problem. Working with HIMSS on different work groups, and also I'm involved. I recently won number one prize at Siemens Innovation Think Tank. So what is basically a model of care? How the state can be a motivational driver about this? This is something that we really have done in Pakistan. So telemedicine is growing globally, and after the pandemic, it really the question of why has really gone out, and now this has been skyrocketing the use of telemedicine in every part of the world. So just I would like to give a perspective what we did in Pakistan, what are the perspectives that we have over here. So Pakistan is basically fifth largest population. It's 220 million population, and the problem is that 50% of this population does not have any access to care. And when this pandemic started in March 2020, so within first 2 months, so we had about 253 doctors got positive and 58 died of this COVID. So that was a huge loss. We in Pakistan there was capacity issues, and with this pandemic, so it just added on to that. Health expenditure in Pakistan is 1.1% of GDP. That is pretty low. So means we are spending very low on healthcare. Tele density in Pakistan about we had 20 million population, and out of 220 we have about 172 million mobile subscribers. That entails to 77% of the population had access to mobiles. So this is something that was for us very important, how we capitalize on onto these things. And obviously, with the population that we have, mostly people are living below the poverty line. So how we really can come up with something? So we defined a model of care that we call 4A's. So it was based upon awareness, how we can create awareness, how we can make availability of a telemedicine solution, and how the acceptance would be done into for those people who are really belongs to different socioeconomic status, and the affordability. So in order to create awareness, we use social media, we use so that one of the unique thing that we used is mobile ringtones. So because our focus was really to create awareness to the people, how do we create awareness? In order to create awareness, we use mobile ringtones. So anytime you are getting a call from somebody, so while you are getting the call, so there would be a message that those messages for we use those messages for the awareness. And about the availability in Pakistan, obviously we are like a low middle income country, a developing country. We cannot afford something with quite a lot of money to put forward. So the challenge for us was like how we come up with a model of care that is available, that is affordable, and that can be accepted by the large population. So in order to do that, we came up with a very unique model. So state, as a government of Pakistan, Ministry of Health became a driver of this initiative. And what we did, we invited the private capacity. So private capacity, diaspora capacity, and put it into different platforms. Use the telcos to generate some SMSs, and got different doctors from different private and public institutions so that they can provide their services to the large population at free of cost. It was a multi-pronged strategy that we really adopted in phase one, and then in phase two, we went into the more kind of centralized engagement. So in phase one, what we did, we engaged different telehealth platforms that were working in Pakistan. We engaged basically volunteers, the diaspora, people who are living out of Pakistan, how we can utilize them to give care to the large population. And then the other thing that we did, we involved the telcos into a mainstream of the delivery. So use some SMSs, and we made a central uh, like services contact center with the like 1166, and we called it Sehat Tahaffuz. So Sehat Tahaffuz means value of personal care. And then we introduce some WhatsApp chat bots through which a user can just come up on the WhatsApp. He can send a message, so automatically those messages are responded by the chatbots. So these were some of the strategy parts that we done in the first phase. And based upon this learning, we thought that it was a quite a successful model, and the numbers were there, and it was quite a large number. We served more than a million population through this telemedicine setup. Then we thought that we now we need to go to the next step. So next step should be a centralized telehealth platform, and that is led by the government, and it should have more standardization of data and the processes, and ease of use would be the main pillar of this strategy. So we involved public private into it, and there was we are putting monitoring regime. We use prediction models, and then integration of these like 1166 into feature phones. So this is what we have done all this. And so with this multi-pronged response to COVID with the 1166 helpline. So there is a one case study that I would like to show over here. So a lady sitting on this 1166, she got a call from 75 years old person in the morning, who was very scared, confused about the COVID situation, and he was thinking that he had COVID, what needs to be done. So he asked that if sunbathing could help him to stay protected from virus. So that lady explained him, no, this is not a protective measure. So then he found himself okay, and so this is one of the case that how the people were really guided and educated through this platform. So the lady that was named Sadia, and she was saying she was getting about 250 calls per day, and from 8 to midnight every day, 7 days a week, and about 80% of those calls were related to COVID. And about moving forward, what are the drivers for telehealth adoption? That is very important thing. We used agile learning experience. We were not having the time to just do a lot of planning. So we done a planning in a short period of time. Within month, we started acting together, got some learning, and now we are at an enhanced stage. In this scenario, the the key driver was uh, the platform should be accessible through apps, through web, and without any bias. Like this technology should be for the Android, for iPhone, and even if there is some people who really don't wanted to use the mobile apps, so they should have a simple link sent to their mobiles through SMS or emails, and they click on the link, and immediately they get into the call. And then one of the main function was how to make a connected conversation between the doctor and patient, and the caregivers who are involved into giving the care. So we used voices to create voice recordings, video and text based chats by the patient to the doctors. And about the first phase, where we started in March 2020, when in the end of March, the first case was reported, and there was about two cases at on 26th and 27th of March. And then in May, as the lockdown was started, demand was increased. Hospital services was just restricted to only critical services. OPDs was stopped, and a lot of doctors were getting infected. So we started to launch different chatbots, telemedicine platform, and a centralized communication hub for all these things until December 2020. So about 451,000 COVID patients were reported, and about 9,000 deaths were due to COVID. And our response was within these 7 months. So 300,000 consultations were done through this telemedicine platform, and out of these 300,000, 3% were COVID patients. I was talking previously about how we really use the ringtone messages. So these are some we just started. It was a multi-pronged strategy where we use it for the knowledge building, uh, even the perception building, and how we can really change the behaviors of the people. So, about 113 million messages were broadcasted in this period, and that really helped to just about gain about 71% people just got the knowledge about the symptoms of the COVID. About 31% got the perception that it is something serious, and we really need to just be very cautious about it. And then about 43% uh, patients, or the people were more likely to wear mask, and this is the huge number, and that is study that was posted by Gallup, Pakistan, and United Nations Development Program. That's very important. These numbers are really something that really helped us to educate the people at large. So about the patient experience with this telemedicine, we recently started a study that was from March 24, 2021 to April 9. So essentially, it was about a 15 days study. So within that study, the about 262 patients were asked to give feedback. About 15% really responded. They provided their feedback, and the level of satisfaction was about 76%. 76% given excellent rating of telemedicine services that they use. So this is like a huge number that really uh, is the testimony of our thought process. So about this initiative, we called it Sehat Express, means the health at the speed. If I just say the same things, because we use it Urdu in our local language, so the names that we put were the same Urdu names, and if we just say it in English, so it's like health care at the speed. So what it really provides, platform provides e-prescription. So and it also, when you have done your consultation, then there is a 1 to 5 scale rating of the patient experience, and he patient can also give his reviews, like what he thoughts and what he says about it. And then we really are integrating this platform with the entire government hospitals inventory, so that people can, if some orders are generated from this platform, so people can really have those medicines at their homes. So we have not really started this initiative, but we are just planning to do. And one of another important platform is, it's a multilingual. It's in English and it's in Urdu, so that people from both different languages, they can really understand. Because in Pakistan, most of the people are good in English. So this is it. And then patient can upload their reports. They can upload their vital signs through their mobile apps or through their web portal. And and now, assuming these are all those patients have their mobile phones, who can communicate through their mobile phone, they have mobile apps, or they have access to internet. So what to do with the people who don't have any access to internet? So we established this central helpline 1166, and so that was also integrated to platforms. So any person calling from his mobile, it may be a landline, it may be a mobile phone, or simple feature phone which has just a few buttons on it. So he calls from there, and immediately that call was landing to our central exchange. And through central exchange, it would really connect to the next available doctor. And doctor can just fill in the information about the patient. When all the information is done, so the prescription is sent to the patient on his mobile phone. So that is like a very important thing that we did, and it really helped us to make the inclusivity, because we have to make a platform that is inclusive, that can address the problems of people from different background, be it a different socio-economic status. So people who are living at the villages don't have the smartphone, they can connect, they can communicate, and they can get the right guidance from the doctors. Then we also try to like put webinars or e-learnings for the doctors. You see, this was entire world was a different world post COVID, where we cannot bring the doctor to some place and train them on continued medical education. So we thought that it would be good if we can give them some platform based interface where they can have continued learning, what is next, or the next like guidance are coming from WHO, how to apply those guidance, what are the treatment regimes that are keep on changing, and how to apply those new treatment regimes and all that stuff. So that also helped us to just educate the doctors more and more. And we also put like automated calls to the patients. So means if there is a patient, he would got automated call from a robocall, and he can just uh, on few clicks, even on one click, he can give his experience feedback. So about this, like how this it was like we put it in into a three steps. So our theme was affordable, accessible healthcare for the large population. So Sehat Express really worked uh, under the government initiative, pull all the different capacities that were available with the private sector, and we integrated different diasporas, uh, healthcare workers, and people who really wanted to volunteer into all these things. So we bring all these people into this one platform, and this is how it really turned out to be a success story. About the recognition that we got, uh, WHO chief said about it, world should learn from Pakistan about the COVID, how to manage the COVID. So this was a big appreciation that we got from some of the big names in the world, and then about our telemedicine initiative, UNDP made a report and they put it to public. The topic of this report was how telemedicine is helping in the fight against COVID-19 and why it should be here to stay. And this was again another testimony of what we did and how it was really accepted by the global community. So, what are the key takeaways from all this initiative that we done? So, one of the first takeaway is easy to use technology. So, technology should be very easy. It should be a few clicks, and ideally, it should be one, two, three. So, we made it in a one, two, three means you get on board, take a consultation from the doctor, and you get the prescription. So these were three steps that were involved, and even a simple patient who are less educated can have it. Value of integration: you put something you cannot in such a pandemics, or where the integrated response is required. You need to bring all the stakeholders into one platform and make a really a good bridge between the demand and supply. So this is what we did with this, and this is a lesson that we learned, like how really to act fast, how to bring different capacity that are available into one platform, and how to converge it into better patient care and inclusivity. So inclusivity with the large population, with the different challenges, who really patient who cannot really pay, who are from a different social and educational background, how to really bring them on one platform. This inclusivity really helped us to serve the masses. And the other thing, the trust, how to bring the trust. So if the state is there, state is taking care of all these initiatives, then building the trust becomes very easy. So we use the state to leverage and bring the trust among the stakeholders. Now, talking about this is what we really did in this period, and how we are just really going next in this journey. The idea is the planning is now we need to scale this initiative into a different dimension based upon the learning that we have done in the first phase and the second phase. So we are scaling it to a model of care where we would be onboarding the public hospitals, link it with the disease surveillance so that anywhere where the disease is happening. Like, see, if on a lab test result a patient is COVID positive, immediately he would get a message, look, this is the link. Just go on this platform, sign up, and get the consultation from the doctor. Means you are giving an integrated response to the people. Interoperability is one of the key how we can really integrate different platforms that are available to this platform. So what we did, like this was very important aspect of the success. Rather than making something new, we put a platform, a central hub, and ask all the different people who are doing work on this to just integrate this. So what's happening on the one side, demand is coming to this platform, and this platform is really disseminating the information to all these different platforms who are working over in Pakistan. And with these initiatives, we are planning to do 1 million consultations by end of this year. uh, we wanted to work on the policies and regulation side so that this should come into a regulatory framework, so monitoring evaluation can be done. And then, like in we also are thinking and talking about this, how we can really put this initiative into medical education for the students who are into the medical college, so that they are coming trained about these platforms. They are having the basic how to really deal with these platforms, how to provide the patient care. And then obviously adaptability from the doctor side really becomes easy. And the third thing that is coming into our journey is how we can really make it a commercially sustainable model. So in order to make it commercially sustainable model, yet it should be the people free of cost for the people who cannot afford. So it would be a cross subsidy model. So this is it. Anybody if wanted to contact me, I'm really passionate to work on future of care and caring. So, and I can be reached on LinkedIn and Twitter or email. So so any thoughts, any help, or anyone who really need to learn more, so I'm happy to just guide them. And I'm really thankful to HIMSS and Clean and Cleaning for providing me this opportunity to speak on this conference. Thank you.
On behalf of the Cleveland Clinic and HIMSS, I would like to thank all of our speakers for their participation in the Patient Experience Summit, and to all of you for being a part of the critical conversations needed to enhance the focus on technology and more deeply explore how healthcare is extending empathy into an increasingly digital environment. Don't forget to take our brief event survey about today's event, which can be found at the bottom of the navigation bar. We want to hear from you. Your comments will enable us to better plan and execute future events and tailor them to your needs. I wish I had the opportunity to give all of you a big virtual hug, and I hope to connect with all of you in person this time next year. In the meantime, please know you can still dream big, be bold, and we are all right there with you. Fellow empathy amplifiers, thank you.